The first component of longevity is don't die. So we promote that in our center, and we screen for cardiovascular, number 1 killer, cancer, number 2, and then we do neurodegeneration, number 3. And there are some simple things that you can do. We do VO2 max testing for cardiovascular disease. It's the number 1 predictor. You get on a bike, you get an EKG, and you get forced volume of oxygen. You can pick up cardiovascular disease 10 to 15 years before it ever becomes an issue. It's at a microscopic level. This should be in every cardiologist's office. Cholesterol is not so relevant. Total cholesterol is an antiquated and outmoded test. It came on the market in 1954. You can measure particle size, apolipoprotein B, lipoprotein little a. There are some specifics that actually are needle movers. Cancer screening. We have a cancer screening test that tests for 65 different cancers. It'll give you a yes or no. It's an early predictive agent, so you can really get into action. On neurodegeneration, we test plasmalogens. It's a blood test. It's the best predictor for all neurodegenerative states. This one, there's research showing when you have low plasmalogens in your blood, it's almost predictive for dementia and Alzheimer's. So if you have loved ones, maybe your grandparents or your parents, or you have concerns about that, that's one you really want to get on an annual basis. So there is an array of functional medicine testing, levels of toxicity, heavy metals, exposures to pesticides that you can get screened on to make sure there are no boogeymen, there are no monsters lurking in the closet. It's not okay to just ignore it and think, oh, everything's going to be fine. Or I've heard, that people are concerned, like, I don't want to know because there's no solution, right?